housed within the preventative health education component of the Women and Children Service Line, which is called A Better Start, and that will become relevant later. What we do is two separate sections of the Embrace program. First and foremost, the Parent-Child Education Series. Parent-Child Education Series is a 4-week series. It's 3 hours. The first hour, there's an interactive, fun play activity. We have songs, and we have an art therapist that comes out from the Belmont Center, which is the mental health arm of Albert Einstein Medical Center. Then we have the second hour where the parents and the children are separated. The parents are educated each week on a different topic. They're educated on child temperament, child development, learning how to navigate the healthcare system, and keeping their children safe. For the majority of our parent training, we have different presenters. We have someone come out from the Belmont Center, and he usually teaches our families about how to connect with community resources as well as some of the development issues. Then we have another presenter who herself has 8 children, only one of which is biological. And she talks to our parents about child development, also child temperament, and parenting children when they have difficult behaviors, because she basically has every behavior in her home. Then we are blessed to have a female Philadelphia police officer who is a mom, who brings her daughter with her, who is able to be a non-threatening person in the law enforcement department to talk to our parents. As some of you may know, the Philadelphia Police Department has lost funding, and I love my police officer because she volunteers for me. Then we have the provider side. The provider side, we train our providers. It's a 6-week series, and it has everything to do with child development, child temperament, and it helps our providers to identify when a child's behavior within their center is age appropriate or when there may be something else happening in the home. One of the phenomenons that I love is that we have seen that some of our providers also have children within that age range. So they come to us for both sides of the program. So we're able to really work with them on their skills, not only in the classroom, but also in the actual parenting piece. The third hour of our parent-child education group is that we sit down and we have lunch. And we sit down and we have lunch as a group. It is a family program. So when I talk to my parents, I'm always very open and letting them know my son is 15, and often I have my nephew. So if you have children over for the weekend, please bring them. Just call me, because I'm going to serve you lunch, and I want to make sure that everyone gets something to eat. And then each child is provided a book.
Over the years, we've grown from residential care that started in the early 90s to quite a few community-based programs. And one of the programs that is funded through the Children's Trust Fund is the Family Engagement Program. And we are actually in our 3rd year grant with that program, and a few faces that I met in one of our first grant meetings. I just want to tell you a little bit about family engagement and why we started it. We do have Project First Step already, working with at-risk pregnant women and their families. We work with a very high-risk population of moms who are mentally ill, mentally retarded, drug and alcohol dependent, or who have overwhelming social concerns, such as past and present children and youth involvement, where they have chronic homelessness, domestic violence, those types of things. So we work with the moms when they're pregnant. And then we also have another program where we work with families who are involved with children and youth actively. And the children are either in placement or in kinship, and we're looking at working with the families to reunify the children, or the children are already in the home still with active children and youth involvement, and we want to work with the at-risk parents and their children to keep the children in the home. So the idea for the Children's Trust Fund grant came really from the county and all of the work that we've done with the other services, and we wanted to work really in prevention and work with families prior to getting involved with the children and youth system. So really, of course, all the way around, it just saves everybody a lot of heartache and really money to the county as well. So we started this family engagement service working with a PQAS trained certified trainer who we collaborated with the YMCA. And this trainer who had specific knowledge, in addition to ours, with the mentally retarded population, she went into the YMCA and actually trained the staff members there along with us on how to recognize some of the behaviors that you would recognize with a family member, parent who has a disability, and how better to work with them maybe before things kind of got out of hand. But the referrals come to our service from the YMCA and also from the intake workers and the screeners from children and youth for the families where they get a referral when something doesn't quite seem right, but it's not really a OCY referral yet. So we get involved and go into the family home and look at the situation. It could be they were homeless and now they just got into an apartment and they have nothing. They don't have enough food in the house. They're not connected with the right services to get what they need in the home. It could be an autistic child and a very young set of parents or just a single parent, and we're looking at providing them with services or getting them connected with long-term services so that the child and the parents can be successful together. And I mean, I could tell you stories all day, and I'm sure everybody in this room could tell stories all day about what we see, but that's why we wanted to do it as a prevention to avoid children and youth involvement long term. We've had a lot of success over the years, and we actually started Project First Step way back when with our doula service with a grant from Children's Trust. And I'm happy to say that, and I just told Linda this earlier, that last Wednesday the county approached us and asked us to put a proposal together so they can keep the Children's Trust Fund program that they've been funding for 3 years so that the county can pay for it to keep it in place for hopefully quite a long time.